So let's say that as a result of our meeting together, you came to the conclusion that you were really a pretty likable person, and that you actually were a normal kid who had a lot of bad things happen to her, and that she learned to act in some ways that led her to the conclusion that she wasn't normal, but she really is. So you came to the conclusion you were really normal, and you came to the conclusion that, you know, I can really change things in my life to help me to feel better. What would happen to the way you feel in general if you believed those two things?
I wouldn't be as mad.
So it would probably be pretty helpful in that you wouldn't feel angry so often. And do you think you might actually feel good?
Maybe. Sometimes when my aunt and I go out and we do something, sometimes she says, oh, that looks really good on you. And I know that it doesn't, but for a minute I feel a little bit better.
Yeah. So when you think about yourself as looking attractive, that helps you to feel good too. And you mentioned the last time we met that sometimes I think you said the girls at school say, that looks really nice on you. Not sure, it was somebody.
It was my cousin.
Oh, it was your cousin, that's right, Carla, that would say that. So we know that something that helps you to feel better is when you think that you look really nice. And sometimes your aunt says some really kind of hurtful things about your appearance. Oh, what if it's that your aunt isn't saying that you, Karen, look bad, but what she's saying is the jeans with the holes, the tennis shoes, those things look bad. Maybe she doesn't know really how to say it right. And maybe she makes these kind of generalizations that then really end up hurting you because you come to the conclusion she's saying it's you that looks bad. But it's really just a matter of her taste. You told me earlier that she really wants to see you wear dresses and makeup and all that kind of stuff. So maybe it's that she's saying, when she says that, how bad you look, it's not you. It's the clothes that you're wearing.
She does always say the clothes that I wear are made for boys. I know I look like a boy anyway.
Oh, so sometimes you even think that you look like a boy and you look not so much like a girl. I get it. And I suppose when you think that, what do you end up feeling?
What's the use anyway?
Oh, I'm just going to end up looking like a boy anyway, so it doesn't matter how I dress. And you've mentioned that a bunch of times so far today, that the way that, why bother to go and get your hair cut? Why bother to get your nails done? Why bother to try to dress differently? It's not going to make a difference anyway. And when you think that nothing's going to help, you end up feeling nothing's going to change. How do you feel?
Like I don't exist.
Wow. So it makes you feel so meaningless, like you just don't exist. Holy cow. That would be a really painful way of thinking about yourself. I think we figured out a number of reasons why you're so angry. It sounds like you're angry because you see yourself as not being able to change things, like they're bad and they're never going to change. No matter what you do, it's always going to be that way. You think to yourself that you're not normal. that you think that you're just kind of meaningless and worthless. So, my job and our job working together is to help you to see that those beliefs aren't true. Because I believe that they're not. I think that you are a person that has value. And I think that you're a person who actually can affect the way that you feel and affect other people. And hopefully, working together, we can change some of those other people that make you think these kind of negative things. And if we help you to come to the conclusion that you are meaningful, that you can change things, that you are normal, but you're a kid who's had a lot of rough things happen, then hopefully, and we know that you'll end up feeling better. Let's just say that you thought to yourself, I'm really a normal kid, but boy, I've had some rough things happen. They taught me to do some things that aren't really helpful. And you thought to yourself, I'm just normal, and I can change things, and people can like me and love me. How do you think you would act? Would there be any difference in the way that you would behave and interact with people at school?
I would probably talk to people.
And if you talk to people and you feel connected to people, how does that end up making you feel? Like Alan and Carla.
Good.
Yeah. So if we got you talking to people, and the way to get you talking to people is through helping you to think of yourself differently, then we add to the good feelings that you have. And if you had friends and people that you talk to, what would that tell us about that belief of, I'm not normal and I'm meaningless, I'm tiny?
I would be normal if I had friends.
Huh. So I think today what has been really helpful is we've come up with some things that become our goals for our working together. And it sounds to me like we want to help you to develop friendships. We want to help you to see yourself as being able to make good things happen. We want to help you to see that you're a normal kid. And we want to help you to see that you have value and you're lovable. And that people really like you.
But even if I think that I'm normal, they still know I'm not.
Oh, so you'd have all this worry that other people think you're not normal.
They're still going to be mean to me.
Uh-huh.
They're still not going to talk to me.
Oh.
I'm still going to suck at soccer.
Uh-huh. Guess what? Sounds to me like that helplessness is coming out again, where you're predicting that all these bad things are going to happen. Maybe you're not great at soccer. I don't know. I've never seen you play. And I don't know what kind of coaching you've had and experience you've had with it. It might be that the other kids have played soccer for 6-7 years and you just started. Maybe you weren't as good, but maybe you could catch on. Or maybe soccer's not your thing. But I don't think that the value of you as a person is dependent on whether you play soccer well or not. And I think of you're 12, so you're in 6th grade, 7th grade?
6th grade.
6th grade. When I think about 6th graders, and I look at, let's say, all these normal 6th graders, do they treat each other nicely? You said that if they're normal, then they treat each other nicely. But do they treat nice, normal kids in a kind of mean way at times too?
Mm-hmm.
So it may be that you're just getting treated in the way that all the kids are getting treated. Sometimes not so nice, sometimes nice. But I don't know, we'll have to test that out and see. But just because somebody's mean to you doesn't mean that it's because you're not normal. Might be that that person's having a bad day. might be that that's a mean person. And they just say mean things to everybody. I don't know. It's something we'll have to test and see over time. So today, I think you've done a really good job of talking about some really serious things. I'm impressed. We've only met twice, and you're telling me really important things. And it's been really helpful for me to, in my way of thinking about how we can help you out. So that was great. So I hope that you keep doing it. How are you feeling right now? Are you still feeling like you want to blow up? You still at a 10?
No, more like a 4.
Huh. What caused you to go from a 10 to a 4, do you think?
Talking about it, maybe?
Yeah. You know, I think that might be it. Because you mentioned when you talk to Alan, you feel better. When you talk to Carla, you feel better. So maybe talking to people and having people really listen to you helps you to feel better. Might be that way with some of the kids at school too. The nice ones, not the mean ones. So what do you think were the main things that I'd want you to remember from meeting today?
That maybe kids aren't always just being mean to me. Maybe sometimes I just catch them at the wrong time.
Okay. And that maybe when they are mean to you, it's not because you're not normal, it's just because they're mean.
And that if I think about myself differently, maybe I would do things a little differently.
Mm-hmm. And that you might feel different too. And that the main things we'd want you to think differently are that you actually can change things, that you are a person that's likable, lovable, and you have worth. You're not just minuscule, meaningless. Very good. Anything else?
Maybe my aunt is trying to do something good for me, but I don't think she's doing something good for me.
Yeah, I know. Because when she says those things, it still makes you think that you're not normal or you're not attractive or that there's something wrong with you or she wants you to be someone that you're not. Yeah. And I don't know your aunt, so I think that that's something that we'll have to learn over time and find out what it really is. Great. When you think about today and our meeting, did I say or do anything that upset you or that made you feel bad or angry?
No.
Good. And remember, if I ever do, I want you to tell me, okay? Good. So last time, I asked you as a homework assignment to notice whether there were any kids at school that were really nice and that you might want to make friends with. Did you happen to notice anyone like that?
There's a girl by my locker. We've got lockers, and I couldn't remember my combination for a long time. And I started remembering it, so I started using my locker last week, and she's talked to me a couple times.
Oh. Huh. Why do you think she talks to you?
I don't know. She said she liked my book bag.
How does it fit with that belief that other people, all other kids, think I'm not normal?
I don't think she thinks I'm normal.
Oh. But she still is willing to talk to you anyway. Okay.
She's not normal either.
Oh. Okay. All right. So, again, we're going to have to work on that belief that you have that you're not normal, but we'll do that in the coming weeks. So, would you feel comfortable between now and next time we meet saying something to her first?
Like what?
Hey, like maybe you like what she's wearing, or, that's a cute dress, or nice book bag, or, I don't know, maybe she wears jeans with holes in them, great holes. Whatever. It might be, what do you think would happen if you did that?
It would make her feel good.
Ah. And if you make her feel good, then how do you think that'll make her feel about you?
I don't know.
Maybe good. Might be the start, that's kind of how you start a friendship. So maybe you could do that. And the other thing I think I'd like you to do is keep watching for other nice people. Okay? All right, great. So I'll see you next week. Okay. All right. So I did a little restructuring. That wasn't my goal, but my goal was just to elicit lots of negative thoughts. And did we, thanks, Karen. Yep. And so did we accomplish that? Mm-hmm. We got a lot of negative thoughts, right? And what about, did we get at any of her beliefs? Yeah, we got at the beliefs. So what would you say are the primary beliefs that underlie, and Karen does this really well, that underlie her behavior and her affect?
Worthless.
Worthless. Unlovable. Helpless. Not normal. And
Abnormal.
yeah, abnormal. And what was the one that she said, I lost it, the wording of it. She said it was really powerful. They make me feel meaningless, was it? What was it?
Invisible.
I'm invisible. Yeah, that was a really powerful statement. So I would have wanted to, since I didn't remember it, I would have tried to reconstruct the conversation and tried to remember that because I want to use her words. And so I think invisible is a really important belief to get at. That has a lot of affect surrounding it. Okay. And then I tried to set the stage for the future, like if we change these things, she's going to feel better. And I tried to set the stage for maybe her aunt's not as mean as she appears to be. Okay, so how are we doing time-wise?
About 10 minutes till 3.
Okay, all right. Any thoughts about, oh, good.
When in the group, when someone says negative thought, what is the reaction of the person that gave the negative thought?
Usually they giggle, and I think, I've never seen a adverse reaction to it, and so and I think that's because we build enough cohesion that it feels pretty safe. But you can see that they kind of, well, again, I can't see it because I'm listening to the audio tapes, but the image it creates for me is that the person is kind of startled and they reflect momentarily and then they go on. And that's what we want them to do, is to reflect on it and see if they can recognize those thoughts and become better at it.
When you were talking with Karen, you said she would say that her aunt hates her, and you would paraphrase that you think people, or you would generalize people instead of the aunt. Is that something that you want to do, or would they be offended if you were generalizing?
I didn't really realize I was doing it, but it is I probably was doing it on purpose because what I would be trying to do is show her that there's a pattern of her perception that other people don't like her, that other people hate her. Because she's told us that she is very socially withdrawn. So I'm assuming that the reason that she's so socially withdrawn is because she has the foregone conclusion that other people hate her. So I saw it as a belief and something that would affect her behavior generally. And so that's why I was doing it. Yeah.
I was wondering if she feels abnormal, if something should be pursued in that direction, because that's pretty bad.
Uh-huh.
And what area does she feel abnormal, and perhaps get more of that information out?
Uh-huh. So that's what we'll do after the break. Is if I was in the second session with her, and she's a kid who's oppositional, and I've already got her telling me pretty much, I didn't want to, and I didn't really want to go there this meeting. I wanted to build a little bit more rapport with her and then go after it. And then my objective of this meeting was just to elicit the negative thoughts. So I wasn't going to go after a lot of restructuring yet. But I think that's a great suggestion. Because I'd want to know what it means to her to be abnormal. Now, I did try to plant a seed about that. And you notice that I kept saying to her that she was did you catch it, what I kept saying to you about whenever you were talking about the abnormality?
That I was normal.
Uh-huh, but...
What if you were normal, but you were thinking, well, yeah.
Yeah, that's it. So I just tried to plant the seed for the future of going after the belief that she's abnormal by saying that she's just a normal kid who's had a lot of unfortunate things happen to her. Because that's what I want her to come to the conclusion is that she's normal. I mean, if you think of, here's the kind of underlying theory. So the underlying kind of thought is, how do we end up coming to the conclusion that we're abnormal? Through learning experiences. It's something that she's learned, and she's learned it from the interactions with different family members. So if you've learned something, you can unlearn it. And just because you learned it doesn't mean that it's true. So she's been taught through things that have happened in her life that she's abnormal. And I'd rather have her see that she's come to that conclusion based on unhealthy things that unhealthy people have done, rather than because that's who she is. So that's more likely where I'm going to try to take her, is to that kind of conclusion.
The other thing is if she speaks about it and you get into it in more depth, it may release whatever feeling she's got, or you'll have an idea in what area she feels abnormal.
Yeah, so I'm going to try to get at the depth and breadth of that belief that she's abnormal, and then change it. Paula?
So just kind of, I was just thinking kind of logistically in a group format, in terms of like how much do you delve into that, you know, one individual where the group is kind of watching the process, or how much then do you get the other group members to come up with thoughts and things?
Yeah, good question. So the nice thing is working in the group that over time the kids get really good at helping each other. So if Karen had been in a group and it had been in a group that there was good cohesion, the other group members would have said to her, I guarantee you they would have said this, they would have said, oh, I really like the dress you're wearing today. I really like the way your hair looks. Oh, you'd look really cute if you went to this person. This is where I got my haircut. You know, they offer all these suggestions. And they would say things like, oh, but I like you. I'm your friend. We're in the group together. I'm your friend. So they offer up a lot of supportive comments that help to restructure the belief. I remember one group that I ran that was a pilot group, and one of the girls was very severely depressed, and she said to the other group members, they were 8th graders, and she said, none of the boys like me. They all think I'm ugly, et cetera, et cetera. And the other group members were great at saying, wait a minute, what about so-and-so? He used to be your boyfriend. And what about when you went to the dance? you danced with more people than I danced with, and on and on. And so they gave her concrete evidence that showed her that that thought wasn't true. And okay, if you're 12 years old and you're in a group with other 12-year-olds and they're giving you that kind of feedback, is it more believable than what an adult says it is? So the group, when it's a good group and it's working well and it helps with the restructuring, it's really powerful. Any other thoughts or questions? Tuma?
I had one question. For the games that you play with the kids, like the web activity and the other games that you were describing, like the one with the bead, if there are kids in the group that sort of don't go along with it, they'll say, no, I still feel the bead, they kind of like still continue to be negative. What do you do about this?
Yeah, I would just say to that particular kid, okay, I get it. You tend to just pay attention to the negative. And you're not able at this point in time to switch your focus to the positive. But that just tells me that my job and our job as a group is to help you learn how to do that, to switch away from the negative. Yeah, so I think that one of the things that is important is to have an attitude of optimism, and that as the therapist, when the kids pose those things, that you don't get stuck in their negativity. And then you have the kids that are 12 and 11 that are heading towards a personality disorder, and so they give you lots of that stuff. And you don't want to get caught up in arguing with them. Better off just accepting it and trying to gently nudge it in a different direction. All right, so let's take our break. Okay. I forgot to give you a homework assignment on the break. So just a quick review. So what do you remember from, or what do you think were the important things to take away from the first hour and 45 minutes today? Okay, so back to the idea that we're looking for those underlying beliefs. And so with kids, even more so than with adults, it's important to help them to understand that their emotions and their behaviors are based on what they're thinking, and that the way that they think depends upon the way that they construct their perceptions, and that that act of construction may include some errors. It may lead to them having thoughts that aren't really true, and that you have a choice about which thoughts you want to believe. Okay, so the bottom line is Judy Beck always has kind of coined this phrase of just because you think it doesn't mean that it's true. So that's the bottom line. We want them to get the idea that just because they think it, it's not necessarily true. So that's really important. And then we did the role play with the idea that we were going to demonstrate how to elicit negative thoughts from the client. And we got lucky because along with the negative thoughts out came negative beliefs. Okay. All right, so remember the second half of the treatment really goes into the cognitive restructuring. So that's what we're going to concentrate on now until lunch and maybe a little after lunch. We talked a little bit about why you might why we waited until later in treatment to introduce the cognitive restructuring. And one of the reasons is in cognitive inflexibility. So our anxiety treatment group isn't here today. But some of those, like Paulo, you mentioned yesterday, treating people with OCD. So when you're treating someone with OCD, for example, what do you notice about their belief in their obsessions or their other anxious thoughts? What's true about it?
100% true.
There you go. So when you're first working with someone with severe anxiety, and especially with OCD, the person believes those thoughts 100%. As absurd as they might be, they still believe them. They can even, at some levels, say it's absurd, but they believe it. Okay? And why might that be that way? Because it's due to OCD is a brain-based disorder, and so they're really stuck in thinking, and it's an overactive area of the brain. So what happens over time with the patients that have OCD and you're using the exposure and response prevention procedures, what happens to their beliefs?
Down.
Yeah, it goes down in magnitude and they start to be able to question it. And as you go on in therapy, they start to be able to use their own thinking to change their OCD. So it goes from really rigid, stuck, they believe it 100%, to more and more flexible, and they start to be able to believe it and then use the healthier way of thinking to help them combat the OCD. So it's kind of the same thing with depression. They start out, when they're really severely depressed, with very rigid, stuck thinking. And so they can't do the restructuring. So in the role play, if this was really the second meeting, and I'm trying to attack some of Karen's beliefs, I'm likely to butt up against, well, maybe but, a lot of her negating what I have to say. So instead, I'm just going to plant seeds, and later when I see there's flexibility in her thinking, I'm going to start to do the restructuring. So you wait until later because you're trying to get rid of the inflexibility. So with the anxious patients, the OCD patients, we use exposure and response prevention to get rid of the inflexibility. What do you think we use with the depressed patients to get rid of their inflexibility?
To catch the positive?
There we go, catch the positive. That starts to help them to see it, and it helps to break the inflexibility. What else do we use to get rid of the inflexibility? Coping skills, the behavioral activation. So we get them behaviorally activated, their mood improves, and it helps to break the inflexibility. Okay? And the same with the problem solving. If they are very inflexible and then they start to see that problem solving can work and relieve some of the stress, then it also breaks some of that inflexibility. So we use the behavioral activation strategies, the coping skills, the emotion regulation, and the problem solving, all to help improve mood and reduce that inflexibility. And then we do some of that education about thinking to break it too. So we also wait until later because you want to build rapport. You want to build credibility too. And we want to educate them about the link between thoughts, emotions, and behavior, about the nature of cognition. We want them to be able to start to identify the negative thoughts. It gives you a chance to start to know the child and understand their way of thinking. And as we mentioned earlier, if we focus on the thinking too early before they have the skills to manage it, then it brings their mood down and they're stuck. some of the general rules for when you're implementing cognitive therapy. One of them is that you move from restructuring automatic thoughts to restructuring beliefs. Okay? Start with the easier things. Automatic thoughts are much easier to restructure than are beliefs. Because if you think about it, a belief is something that has a lengthy learning history to it, so it's going to be hard to change. It's going to take a lot of evidence to change it. So, sometimes when you're doing the cognitive restructuring, you come up with a really nice, elegant way of doing it, and the kid gets it, and you're thinking, wow, I did it, I nailed it. And then the next week they come back and the belief is still there. It's because it takes a lot of, it took a long time to learn it. They've taken information and they've molded it into support for it for many years. And so it takes a long time to change it. It takes lots of restructuring and lots of collecting evidence to change it. And you start using the cognitive restructuring in kind of a tentative way, and then you become more kind of aggressive in how you attack it. And initially in treatment, you're the one that's doing the restructuring, but our goal is to have the child do it for him or herself. Okay? So we're going to move from you doing it to them doing it for themselves. That's the key. If you are the person who does the restructuring and you don't teach them how to do it, what's going to happen when therapy ends? Right. So the goal of, if you think back historically about the evolution of behavior therapy from behavior therapy into cognitive behavior therapy, what was the reason why the behavior therapists added cognitive components in? Anyone know?
So that they could do it themselves?
So that it would generalize.
Yeah, it have a lasting effect.
It'd have a lasting effect. So there'd be maintenance and generalization of treatment effects. So that's the whole idea of adding cognition into the behavioral interventions, and led to cognitive behavior therapy. And yet, so that's why it's really important. We want to help the kids learn to do it for themselves so they maintain their gains and they generalize it over time and across situations. So our goal is to change their core beliefs. And so that means with depressed kids, we want to change which 3 core beliefs? There we go. And we also want to, typically, especially with this age group and with the girls, it was we wanted to change their beliefs about interpersonal relationships, and we wanted to help them to develop rewarding interpersonal relationships and adaptive behavior. And as I mentioned, our goal is to teach the children how to independently do this. Okay, so how long or how many sessions would you guess it's going to take a 10, or let's say a 9 to 13-year-old child? How long is it going to take? How many sessions is it going to take for them to be able to catch their thoughts, restructure their thoughts, and feel differently? Oh, just go ahead and guess.
20.
12, 25. Okay, so how many does it actually take? I don't know. It was a trick question. But the reason I asked the question was, when you're reading the literature on the treatment of depression in children and adolescents, how many sessions do they typically spend in cognitive restructuring? Anyone know?
2.
Yeah, who said 2? Good guess. That's it. 1 to 2 sessions. And that's what they expect is going to lead to the kids being able to catch their thoughts and restructure their thoughts. Is that realistic? It's not. I think that all it is psychoeducation at that point. It's not psychotherapy. The kids are just given the idea that, okay, you have negative thoughts. If you change them, then you're going to get better. And here's how you try to change them. But it's education. It's not real therapy. There's no actively working on helping the kids to catch their thoughts, helping them to do the restructuring, modeling for them how to do it, teaching them how to do it. It's impossible to do in 1 to 2 sessions. So when you read the literature, especially the review studies about the effectiveness of treatments for depression in children and adolescents, look at how many sessions they spend on the cognitive piece. And it's 1 or 2 sessions, and that's it. So you wouldn't expect it to work. The other problem with the literature is how many sessions do they spend teaching the kids coping skills? 2 or 1, okay? How many for problem solving? There you are. That's it. So the problem is that they typically will teach the kids the skill in 1 or 2 sessions, and it just doesn't work. All it is education. It doesn't really get them to learn it, to master it, and to apply it. So while we were on break, Tuma and I were talking about trainings, and she was citing the literature on the degree of mastery of people who participate in a workshop. And go ahead and tell us the stats.
It's approximately anywhere from 30%, 30 to 40-ish%.
Okay. So you're all, and typically in workshops you have people who've been practicing for a number of years. You're bright and motivated and interested, and so you should be able to catch on to these things pretty quickly. And yet, it takes a workshop plus, like we were talking about in one model, a year of ongoing supervision to learn how to really do these strategies. So how is a kid that's 8 to 14 and not very psychologically minded supposed to learn it in an hour or 2? They're not. So it really takes a long time for the kids to learn it, master it, and apply it. And it's once they start to apply it to their life that they start to get better. So watch in the literature about the interventions, and when they don't work, you can ask yourself, how long? What did they actually do? Now I get it, why it wasn't that effective. Okay. Beck talks about 2 types of cognitive restructuring, and he refers to them as inelegant and elegant. And inelegant is kind of like it's very simple. It's a matter of you teach the kids to substitute positive thoughts for negative thoughts. So we're going to talk about that in a minute. There's no evaluation of the thoughts. There's no kind of teaching them to catch the thought, evaluate it, look at the evidence, and come up with a new thought. It's just a matter of, believe this thought instead. In the elegant strategies, there's Socratic questioning, behavioral experiments, use of others as a reference, acting as if, self-disclosure, and then a strategy that we call the muck monster activity. It was actually what the girls called it in the treatment condition, and it's a developmentally appropriate way of doing cognitive restructuring. Okay, so that's what we'll cover between now and lunch, and probably after lunch for a little while. Okay. If you look back historically on cognitive behavior therapy, what were the kind of seminal texts on cognitive behavior therapy? Anyone know? Okay. All right. So one of them, I think there were Beck's books on cognitive therapy, which really started in about 1967. And then there were the books in 1974 by Mahoney and Meichenbaum, where they coined the term cognitive behavior modification. And then since behavior mod had a little bit of a bad connotation to it, they changed it to cognitive behavior therapy. Okay? And if you look at Meichenbaum's book in 1977 on cognitive behavior mod, he was one of the first people to talk about a strategy called self-instructional training. And self-instructional training stemmed from the Soviet research on the development of thought. And it was Vygotsky and Luria's theories about the development of thought. And what they were proposing in a nutshell was that kids their behavior was managed through, initially in infancy, through things that other people said, so from external verbalizations. And then with time, the external verbalizations start to filter in and they become internalized, and then you have internal thought, which then guides behavior. Okay, so that was the theory. And so Meichenbaum took that theory and said, okay, if I want to teach someone a new way of thinking, it's going to go from the therapist verbalizing the new way of thinking to the kid verbalizing it. So the therapist verbalizes, the kid verbalizes. Then with time, you start to fade that out. And so they had a step of whispering it, to then the kid just thinking it and the therapist checking to see if they were thinking it. And he called this form of changing the person's thinking self-instructional training. Okay? And so that form of restructuring a person's thinking became really popular and was used by a lot of different clinical researchers. And it was kind of like the first, or one of the more popular forms of cognitive restructuring. At the same time, Beck was developing cognitive therapy and was talking about the more elegant ways. And Albert Ellis had his ABC model, and he was using a form of cognitive restructuring. So there were these three kind of different models all coming out at the same time with different ways to restructure thinking. But with kids, the Beck model was with adults, Ellis's model was with adults, but Meichenbaum was with adults and kids. So in kids, the way of restructuring was self-instructional training. Okay? So that's a more inelegant way of doing it in Beck's terminology. And what you end up doing is you teach the kids coping thoughts, essentially. So they notice that they have a negative thought, and you teach them to replace it with a positive thought. Right? So it's kind of like there. It's kind of like this. where the kid catches the negative thought and then they replace it or add in this coping thought, and the idea is then they feel better. Okay? So what's the limitation of that strategy?
You're not getting at the underlying.
Not getting at the underlying beliefs, right? So you never change the underlying beliefs. So from a theoretical perspective, from the CBT perspective, you're not changing the core beliefs, so you're not really going to produce long-term changes. And what's the kind of most common criticism from other perspectives of CBT? It's so shallow. It just teaches them to change the thoughts. It doesn't go for deep change. But in reality, it does go for deep change because you're changing core beliefs. Okay? Okay, so one problem is it doesn't lead to change in beliefs. What's another problem with this approach? What if the kid doesn't believe the replacement thought? They're just parroting words, and it's not going to do any good. So if you're going to try this more kind of superficial approach to cognitive restructuring, then you need to be sure that you give the kid thoughts that they believe, that he or she believes, okay? So they have to be coping or replacement thoughts that the child really believes. Okay, part of working with the kids, even when you're doing the self-instructional training, is that you want them to understand, again, that their depression is telling them lies. So, we have a lot of people who work with anxiety disorders here. And if you think about the March and Mule book on the treatment of OCD, what's one of the first steps that you do with the OCD patient?
Tell them that the OCD is outside them.
Yeah, you externalize it. And so when you externalize it, you end up giving it a derogatory name. And so that works with depression too. You want to externalize the depression and the depressive thinking to something other than the child. Makes it easier to change. And for the depressed kids, if you help them to understand that the depression stems from their thinking, the really depressed kids end up saying, oh, now you're telling me I'm really messed up and not normal. It's all due to not only do I not make friends well and I have problems in soccer and my aunt and grandma don't like me, but I also have this screwed up thinking. So I'm really a mess. Okay, so you can get away from that by externalizing it to something other than them. And you do that by giving it a name. So the kids in the groups that we ran said it was their muck monster that caused them to think that way. And that was all because we had this expression that we tried to teach them, don't get stuck in the negative muck. And the negative muck was all their negative thinking. So in the example that Tuma gave us before, what if the kid said, no, I only feel the bead. I can't see it the other way. The therapist would say, okay, you're still stuck in the negative muck. And the kids would get it. That means I'm stuck in my negative thinking. All right, so you're going to try to externalize it. And you're going to then give them these coping thoughts that they can use. So for some kids, they can get it, they can use it, takes them a little while, and it's helpful. Okay, but then there's the more elegant cognitive restructuring strategies. And I was trying to think through what are the steps that are involved in cognitive restructuring, because I don't think I've ever read it. You know, before coming here, I went back into all my textbooks and I was looking at where's a nice succinct summary of how you do cognitive restructuring, and I couldn't find it anywhere. So I had to kind of reflect on the process, and I think this covers it. You start with identifying the negative thought or belief. You link it to mood or behavior. You obtain a mood rating based on that thought. You restate the thought in kind of a testable form, and then you do the restructuring. Then you get a new mood rating, and you gauge the child's belief. And I think I wrote this down incorrectly. It should be you gauge their belief in the old thought. So you just restructured this old thought, and you want to check how much do you still believe that? And then you come up with the new thought, and you give them homework to go about finding evidence that supports the new thought. Okay? All right. So that's a pretty lengthy list of things to do, right? But you'll see when we do the role plays, it's pretty, you can do that quickly and easily, and it doesn't seem like you're doing this long list of things. Okay, so if you look at step 5, use one of the cognitive restructuring strategies, right? So here's the cognitive restructuring strategies. Socratic questioning. We taught the kids that were 9 to 13 years old 2 cognitive restructuring questions. And I think that's all that they could handle. Okay, when you're working with adolescents, they can definitely understand more of the strategies. But the little kids, it's harder to get them to master more than the 2. And we chose what's the evidence, because that one's it's really kind of simple, but elegant. And the other one is alternative interpretation, and we'll talk about what each of these are. The other one that works pretty well with the 12, 13-year-olds was what if? And it's, what's the worst that could happen, what's the best that could happen, and what's the most realistic way of thinking. And that one actually works well with the kids with anxiety disorders. And then another one is, what would I tell my best friend? Okay, so we're going to go over how you do each of these. And then we'll do a role play with them. And then I'll ask you to try them with each other in role plays. Okay, what's the evidence? It's used when the child draws a conclusion that's contradictory to the evidence. And so if I know that the core beliefs that a child that's depressed holds on to are, I'm unlovable, worthless, and helpless, then as the therapist who's going to eventually introduce cognitive restructuring, what am I going to be looking for in every meeting?
Anything that counters that.
Exactly. That's it. I'm going to be making note of everything that provides evidence that contradicts that belief, or those beliefs, I should say. And at the end of the meeting, if I'm staying organized and on top of things, I'm going to write down that evidence. And then before the next meeting, I'm going to review it. And then I'm going to write down more evidence. And I'm going to review it until I start to use the cognitive restructuring. Okay? So it makes it easier if you have in mind that there's those 3 beliefs and you're going to restructure them. That's your goal. Okay? So let's say, just as a way to illustrate it, let's say that we're working with a kid who has the belief of I'm unlovable. What's going to be evidence that contradicts that from your interview with them? What would you guess?
You're going to say that there's someone that cares about them, their best friend, or something.
There you go. They could talk about a best friend. They could talk about an aunt, an uncle, a parent, a grandparent that really loves them. They could talk about kids who aren't best friends, but kids who just seem to talk to them and like them. They could talk about pets. Pets are a nice example because we all believe that pets have a sixth sense. They know who are the nice people and who aren't. So you can use pets as an example. What if it's a pet that's really affectionate with the kid? You know, that is really a nice example. So if you have a 12 or 13-year-old girl and she babysits, and the kids she babysits love to have her as a babysitter. When she comes over, they're all excited, and they snuggle up to her when they're watching a movie together or something like that. What's that? More evidence. Okay? So you look for evidence in everyday events that you can use to help restructure the belief. Okay? Now remember, the idea is that when a person's depressed, they distort the evidence in their interpretations in a negative way, so oftentimes their thoughts are untrue. And of course, if they're true, you're not going to restructure it, you're going to use problem solving or coping. Okay. All right, what would be evidence for a kid from their everyday life that they are not helpless, that they're efficacious? Okay, they do their homework. What else? You know, they do okay in school. Some of the kids might even do really well at school.
They get dressed.
I know. That's what makes it kind of easy, is they got dressed, they made it to the meeting on time, that you can just go through the day's events and, hey, they did it pretty well. If they were totally helpless, they couldn't have done that. They might be good at acting. They might be good at playing an instrument. They might be good in sports. You can find something, maybe they're good at video games, whatever. There's something that they're good at. You can find mastery activities that they're successful at. What about the belief of I'm worthless? How would you help someone come to the conclusion they have value, they have worth?
Somebody cared enough to bring them to therapy. Somebody wants them to get better.
Okay, good. So that's a good example of, obviously somebody really thinks they have value, that they brought them there to get help.
Maybe a classmate asked for help for an assignment.
Okay, good.
If they have a pet and they're the ones giving the food and the water,
Hmm.
they're worthless because that animal is depending on them to survive.
Good, good evidence. What
In the demonstration that you gave too, there was a moment where you said, where you had said like, I'm really sorry that you feel that way. So it gave her some work. Even if there isn't somebody else, you're consistently there, weak
and show her that I care about her and she's valuable.
Right.
Good. Okay. As a society, a culture, we believe that you have worth because you exist. Or at least I hope we do. And that tends to be something that we hold on to. And so, you can at a more conceptual level with older kids talk about that belief. Okay, so the point just is that you know that depressed kids are going to have one or more of those three beliefs. And so over time, you're watching for and catching evidence that contradicts that belief. And that helps you with the strategy of what's the evidence. So you would catch the thought, link it to mood, check their mood, get a mood rating, restructure the thought, get a new mood rating, and then ask them, what do you think is a more realistic way of thinking? And then you want them to gather additional evidence for that. Okay, so does that one seem kind of simple or easy or logical? Yeah, it is. It's logical, it's kind of easy, and the kids get it real quickly. And so we just referred to it as them being the thought detective. And like a detective, they would go out and they'd look for the evidence that supports or refutes their thought. And then we also referred to it in another study as the thought judge. And like a judge, you would go ahead and you weigh all the evidence and you come to a conclusion about whether that thought's true or not true. Okay, so the kids get that and they can do it.